Today is August 1st, Lung Cancer Day, and after the break, how a local doctor is raising awareness of the deadly disease with his book, An Empowering Guide to Lung Cancer, 6 Steps to Taking Charge of Your Care and Your Life. We'll talk about what this is coming up after the break. Stay with us. Well, today is August 1st, which is also World Lung Cancer Day, a day aimed at raising awareness about the disease and its global impact. Lung cancer is a dreaded disease with one of the lowest 5-year survival rates. Joining me more to talk about this and his book, An Empowering Guide to Lung Cancer, 6 Steps to Taking Charge of Your Care and Your Life, is award-winning thoracic surgeon and author Dr. Eric Presser. Good morning, Dr. Presser. Thank you for being here.
Oh, thank you so much for having me.
So this is really a book meant to be empowering and kind of clear up some of the myths along with lung cancer. It's a bit of a morbid day, but really it's aimed at awareness.
So lung cancer actually kills about 1.6 million people in the world and about 160,000 people here in the United States. And with an 85% diagnosis rate in the later stages, as you mentioned, we have a 15% 5-year survival. And one of the misconceptions is that it's only a smoker's disease. Now, we know that 1 in 6 smokers will get lung cancer, and smokers live about 15 years less than non-smokers. But what many people don't know is that about 15% of lung cancer victims are never smokers. And when I tell people that statistic, they're blown away, because if I told you that you were going to have a 15% chance of winning the lottery, you'd be playing every day.
Yeah, and there are other things besides smoke that can lead to lung cancer, other carcinogens and asbestos,
Sure.
things like
radon, asbestos exposure, and secondhand smoke. In my book, I mentioned third-hand smoke, which many people don't even know what it is.
A lot of people don't talk about third-hand smoke. Explain that for us.
So what third-hand smoke is, it's actually the toxic cocktail that's left behind literally when the smoke clears. It is the byproducts that get in our hair, our skin, on the furniture. And the classic scenario that I give to everyone is when someone goes and smokes a cigarette outside, they come back inside. All of the toxins are on their clothes, in their hair, and then little children come and climb up on them. They read a story with them, and you're actually exposing them to all of these toxic chemicals. Now, we don't know the actual detrimental effects, and we probably never will, but common sense tells us that it's not good for lung health. It's not good for developmental issues with the children.
So really today, August 1st, is designed to raise awareness of this and really allow you to take charge of your own care, which is something you talk about in these 6 steps. Explain how we should be taking care of ourselves.
Well, right now, okay, when I started writing the book, lung cancer screening wasn't approved by Medicare and Medicaid services, and it is now. If you are between the ages of 55 and 77, and you smoked a pack of cigarettes a day for 30 years or 2 packs a day for 15 years, and you are an active smoker and you are asymptomatic, you should get a low-dose CAT scan of the chest. Now, that's just a start, because I just mentioned that 15% of lung cancer victims were never smokers. Right. So it's really a day for awareness. It's really a day where everyone should kind of perk up and say, okay, I know that gentleman, or I know that loved one who died of lung cancer. Everyone knows a smoker. But we really have to start empathizing and really start realizing that lung cancer is the #1 cancer killer in the world. It causes more deaths than breast, prostate, and colon cancer combined.
Yeah, people aren't aware of the statistics. It's pretty alarming when you hear that. I appreciate you raising awareness for our viewers this morning and for being here and talking about empowering ourselves.
No, absolutely. And they can actually go to my website, ericpressermd.com, and they can buy the book and they can look at some of the other stuff that we've done.
All right, Dr. Presser, thank you for being here this morning.
Thank you for having me.